Today's episode of This Is Getting Old, Moving Towards an Age-Friendly World has been sponsored by the George Washington University School of Nursing. Welcome to This Is Getting Old, Moving Towards an Age-Friendly World. I'm your host, Melissa Batchelor, and today we're going to be talking about nurse practitioner school, and in particular, what do adult gerontology primary care nurse practitioners do? So I'm joined today by Dr. Maggie Venzke, who's the program director for the Adult Gero Primary Care Nurse Practitioner track at GW, and Laurie Wilson. So welcome to both of you. And before we get started, maybe you can just tell us a little bit more about yourself.
Great, Dr. Batchelor. I'm Laurie Wilson, and I am an adult gero primary care nurse practitioner, and I have been practicing for nearly 28 years. I don't know how that is possible, but and I've been teaching at George Washington University for 12 years. Prior to coming to GW, I worked for the American Association of Colleges of Nursing, where I helped work on developing geriatric competencies and teaching faculty how to infuse geriatrics into their curriculum. And I also do a 2-day-a-week clinical practice for the George Washington Medical Faculty Associates Geriatrics Palliative Care. And so I get to do my two passions, which is teaching and practice.
And just a side note, for those who don't know, I always credit Laurie for launching my career kind of into podcasting at a level outside of my own school. She and I met when she was with the AACN, and she actually facilitated me doing my first podcast through the GNEC program. And so Laurie and I have known each other for a long time, but I always like to give her props for that, because it led to a lot of other things that propelled my career and led to this podcast. And we're here today.
It's exciting to be on a podcast with you. So good.
Yeah. So Dr. Venzke?
Yes, I'm Maggie Venzke, and I'm delighted to be on this podcast with my colleagues here. And I work very closely with Laurie Wilson. I am the Adult Gerontology Primary Care Nurse Practitioner Program Director. And I've been a family nurse practitioner, but with a lot of experience in adult health and geriatrics through my career. I've been teaching graduate nurse practitioner students for 28 years, and my career as a nurse practitioner, it's hard to believe, is almost coming up on 40 years. So if I think back on my career a little bit about, as I'm a family nurse practitioner, when I went to graduate school, that was sort of the only game in town. And so there was no opportunity to really launch into a passionate career choice, such as working with older adults. Although my master's degree was all about geriatrics, my very first job as a nurse practitioner was at the Veterans Administration in Richmond, Virginia, opening a nursing home care unit. So I am very passionate about the adult gerontology NP role, and I love teaching, and that is one of my passions, and I love facilitating people's careers in this pathway.
Right, and you and I have that in common. I'm also a family nurse practitioner, but have only ever worked in geriatrics. I've never actually worked in a hospital. Laurie, however, has had a little bit different version of that career path. So what exactly do adult gero primary care nurse practitioners do?
Yeah, so adult gerontology nurse practitioners care for adolescents, so usually around age 13 up to the very frail elderly. They provide primary care services to those, so anything focusing from health promotion and disease prevention to management of chronic illnesses. They diagnose and treat, and they also work on building relationships with families and caregivers. And one of the things that I adore about the role is that I can be engaged in continuity of care as a primary care provider. So I can often see the same patients over and over again and really get to know them and help them set goals of care and help them meet those goals.
Right, and I think that's, we also have another podcast on the adult gero acute care nurse practitioner option, and that is really a lot a turnover. And I do think bringing out that relationship that you get to have and see people over time is really what the primary care option helps people to do. So maybe now let's talk a little bit about where do adult gero primary care nurse practitioners practice?
Absolutely. So there is a large variety of settings that we can practice in. And when we talk about some of the younger people, the more ambulatory people, practice settings like outpatient clinics are common. But with the growing elderly population and continually growing for at least the next 20 years, sometimes we need to meet people where they're at for their care. So you can do care in facilities like assisted living, skilled nursing, home care. And we've even been doing a lot more telehealth recently. With COVID, we became further skilled in telehealth, and I continue to do some telehealth now. So those are just a few of the opportunities, but there's a lot. So, some even specialize and might be located in hospital settings.
Right. And so one of the differences too is the adult gero acute care yesterday, or on the other podcast they were talking about, that's from age 17 and older through the end of life, and you're at 13 through end of life. So there are variations in the populations, even just between these two career paths, even though they sound like very similar age groups. So Dr. Venzke, maybe you'd like to brag a little bit about what some of our alumni are doing.
I would be delighted. So just wanted to speak for just a moment about that age population parameter. It is a little bit flexible, and I think there's no like magic to age 13 and up, but it is really about sort of late adolescence and the development into adulthood. So that's why adult gerontology primary care NPs take care of that population. Where our alumni have been a variety of settings, and I think this is what is really exciting because we're watching the future in front of us. There will be all kinds of different opportunities. And so some of our nurse practitioners, you become an adult geri nurse practitioner, use that education and clinical experience, and then go into an area that they're really interested or passionate about. We have several who go into oncology as nurse practitioners in a primary care setting. So they're not in the acute care hospital, but in primary care. We've also had some recent graduates who've gone on to do NP residency programs. And one of those graduates is in Chicago, and they're actually working with the LGBTQ community in underserved area of Chicago. Another one of our alum is in a federally qualified health center serving underserved populations in Hawaii, which sounds really exciting, but also they are, again, these particular alum are very passionate about developing their careers, taking care of underserved, and also working with the geriatric population. I might add home health visits, telehealth, just as Laurie Wilson was saying, I think are wide open as we begin to look at where this role will go in the future. And we know that the baby boomers, myself included, are aging, and we need nurse practitioners in a variety of settings.
Right. So one of the things that you made me think of is that all these programs, even though they sound highly specialized, adult gerontology, acute care, primary care, that they actually prepare you to be a generalist. And then you still can practice in specialty areas and use, your expertise in, oncology or cardiac, orthopedics. So making sure that you understand that, just like a baccalaureate degree also makes you a generalist. So speaking of kind of specialty and faculty experience, I know sometimes students wonder how much faculty actually are still practicing. And Laurie, you mentioned a little bit about your practice. So what are some of the other practice and experiences that other faculty have within this program?
I know that Dr. Venzke practices, and she has an interest in infectious disease. So I can have you share a little bit more about that and kind of how you got there. So we have a variety. Our program is a small, close-knit program. So we bring on board what are called clinical experience faculty to work very closely with our clinical students, and they come from a variety of clinical practices. So I think, I personally can't imagine teaching without practice. I immediately have case examples and presentations, and it keeps me, current on, very current in my practice. And Dr. Venzke, do you want to share a little bit about your practice, why you choose to?
Right. So as a full-time faculty member, I too agree that clinical practice is really important to keep you current, and also it's one of my loves is to actually work with patients. And so I just want to take a moment to tell you that I kind of have done the spectrum from the adult Jerry. I've worked in student health services at a university. I've worked in home health. I've worked in public health as a nurse practitioner. I even had a job in occupational health at the Library of Congress as a nurse practitioner. So that's why I say that the door is wide open about what you might do with your practice and your career. For me now, I am a part of a nurse practitioner run clinic that actually is involved in infectious disease and travel medicine, where I prepare folks for international travel. So I find it's for a once a week practice. It's very fascinating. And I will tell you, the majority of that practice are older individuals who are seeing the world. And so I really spend a lot of time about what's going on with them in their health conditions, how they can prepare for international travel, and what do they need for immunizations. So it's become very specialized, but a very, I would say, fun practice, and keeps my skills up as a nurse practitioner.
The George Washington University School of Nursing has 3 highly ranked online master's program options to help you get there. Check out our Adult-Gerontology nurse practitioner in either acute care or primary care, and our psychiatric mental health nurse practitioner programs. All 3 are in high demand with excellent starting salaries. Applications to start our programs in the fall are due each year in May, and to start in the spring, applications are due in October. You can learn more and get exact due dates by visiting our website, nursing.gwu.edu. Right. Sounds like a very age-friendly practice.
Yes, exactly.
All right. So if anyone was considering our program, let's talk a little bit about how the program is set up, and and then the role of simulation.
Our program is our master's program, our postmaster certificate, and the DMP program. Those are all different ways to become an adult gerontology primary care MP. And they're set up so that they are online. All the coursework primarily is online and asynchronous. And there is some exception to that. We do bring students to campus during their program of study, which is 48 credits. We do bring them 3 times to campus. One is once they have finished their advanced health assessment course, which prepares them for their first clinical experience and gives them the skills that they need in the clinical arena. We bring them on campus and prepare them with workshops, what to expect when they're going to clinical, how they're going to function as an advanced practice nurse, not just as a nurse, but developing those skills. So we bring you on campus for that prior to your first clinical. We also bring you back again in your second clinical rotation and put you in our simulation center, working with standardized patients, which are individuals that are hired. Some of them are actors, some of them are people who just want to play the role of patient, and they're given scripts, and you're able to go into the simulation center and take over and do an assessment and provide a plan for that patient, and then you'll have faculty oversight on helping you develop your skills. And the third and final time is we come to campus just prior to graduation. So simulation, although we are an online program, we feel like it's extremely important to see our students and to really work with them in our simulation center to help them develop the skills they need and prepare them for graduation and beyond.
Right. And so I do think one of the things to highlight the difference that this program, you can live anywhere in the US and you come to campus 3 times throughout the entire program.
Correct.
Right.
You can live anywhere in the United States and become one of our students in our program. There are a few exceptions, and I would have you check in with our School of Nursing Admissions Department regarding those exceptions. We do prepare you to sit for a national certification exam, which is across the United States. And that's an important factor for you to know, that at the end of your program, that is, you'll sit for a national certification exam in order to become licensed as an NP.
Right. And that's true for any program.
Exactly. Yes.
Wanted to piggyback just a little bit on Dr. Venzke's comments. So although we are across the country, we do have many opportunities remotely to get to know our students. We get to know you, somewhat personally. We know what you're juggling in your life and your goals for school. So we do meet sometimes just for Zoom touch base meetings. We do some online verbal case presentations. So it's amazing. Students talk about, even though they're online, that they can feel very connected to the faculty.
Right. And I do think that there are some online programs that do that very well. And I think that GW is one of those. And so now let's talk about why someone should choose GW's School of Nursing's Adult Gero Nurse Practitioner Primary Care Program.
This is a terrific opportunity to brag about GW's Adult Gero Nurse Practitioner Program in primary care. It's for the 6th year that the U.S. News and World Report has ranked our program in the top 10. We were ranked number 6 for online master's program in adult gerontology, nurse practitioner primary care, and also for the doctorate in nursing program ranked number 10. So we're an amazing program, and we also have stellar certification pass rates. So for both our 2 different certifying exams.
Okay. Want to say anything? Well,
yes, I'd like to just speak to also why you should come to GW is because of our amazing faculty. I think they're experienced. They love to teach. They love to kind of facilitate and mentor students. And I think the fact that our program is a little bit smaller, we have that opportunity to do that. And I think it's, as we said previously, it's a wonderful opportunity, and we invite you to really take a look at us and be a part of our GW family.
okay.
You also have an option you're going to be completing 600 clinical hours over your program in a variety of settings. So it really helps you explore. Maybe you're not certain exactly where your interests or your passions are, but this gives you an opportunity to explore and discover that. And, some people right from the beginning of the program say, I know I don't want to work with young children. So that's why they select the adult gerontology, but maybe they weren't sure they wanted to practice with geriatrics, but they do a clinical rotation like I did, and absolutely fell in love with that role and chose to pursue that role. So it's, you don't have to know exactly where you want to be and what you do when you start.
Right. And I would say that I think there are a lot of adult gero nurse practitioner programs in this country that actually don't have faculty with gerontology, geriatric experience. And so I do think that the depth and breadth that our faculty bring to the gero piece, is really important. Just because I've been faculty before in schools where I was the only person who'd ever you had any experience in geriatrics, which was why you were doing that whole project with AACN,
Right.
was to try to build that. And so I do think that's one thing to consider. Even if you don't think you want to go into geriatrics, you need to understand that right now, like last year, the millennials started turning 40. They are the oldest generation. I mean, they're the largest generation. And in 15 years, they're going to be 65. And, so there are more people over the age of 40 than there are under the age of 18 for the first time in human history. So by default, you will be practicing in geriatrics because older adults take up 60% of hospital beds, and they are, 85% of our healthcare recipients. And so I actually had students, tell me, well, I'm going to work in a NICU. And it's like, well, that's great, but there's going to be a grandmother that's going to come in there who might have a hearing impairment or might have a visual impairment or might have a slight cognitive impairment. And you need to know how to interact with them regardless of what setting you're in. And so it's not just nurse practitioners, it's everyone in healthcare, but also our first responders, police. So by default, everyone's going to be working with older adults because there's just no way around it.
That's right. Absolutely.
So if someone was interested in our program, what would their next steps be?
They could, if they're interested in our program, our enrollment department, our admissions department they are very savvy at finding out what your interests are and directing you appropriately. So nursing@gwu.edu, or more on a personal note, if you wanted to contact me directly via email, mvenzke@gwu.edu, I'd be delighted to have a conversation with you about the program and about whether this is your career path.
That's mvenzke@gwu.edu.
Yes.
Okay. And then Laurie?
And I'm also, very excited to talk to people about becoming a nurse practitioner and help you think through what it is you might want to do. And my email is LD Wilson, LDWILSON @gwu.edu.
Okay. And you can also get in touch with me, Melissa B, PhD @gwu.edu. All three of us would be available and could either direct you or set up a time to meet with you to talk about our program. And definitely, if you apply and come to campus, be sure to email us so that we can meet you for coffee, either virtually or when you're here 3 times when you're on campus. So thank you, ladies, both for being with me today. And hopefully we'll have a lot of people join us in our adult gero primary care nurse practitioner program. So thank you.
Great. Thank you.
Today's episode of This Is Getting Old, Moving Towards an Age-Friendly World has been sponsored by the George Washington University School of Nursing. Thank you for tuning in to This Is Getting Old, Moving Towards an Age-Friendly World. I'm your host, Melissa Batchelor, and if you'd like to learn more, you can check out my other episodes on my YouTube channel by subscribing and ringing the bell to get immediate notifications when new content comes out. In addition, you can also find the audio version of the podcast on Amazon Music, Spotify, iTunes, and Stitcher. Please feel free to leave an honest review because more reviews mean more awareness of the podcast and helps us move towards an age-friendly world. If you have a comment or a question, you can visit my website, melissabphd.com. Go to the Contact Melissa tab, and you can leave me a voice message. You never know, it might just include your question or your comment in an upcoming episode.